Welcome to Noon Wednesday. I'm Marissa Wojcik, multimedia journalist with Here and Now on PBS Wisconsin. Today is October 13. Across the country, large cities are seeing higher rates of violent crime and homicide, and Milwaukee might be seeing some of the worst as murders and gun violence approach an historic level in 2021. Joining us to talk about their work in the Milwaukee Health Department's Office of Violence Prevention is Kwaku Tiangelo Cargile Jr. and Jamal Smith, and thank you both so much for being here.
Thank you for having us.
Thank you for having us.
I want to start with, as we mentioned, nationwide, cities are reporting higher rates of violence and particularly homicide. So for the two of you, as people who work very closely in this, what does this look like in Milwaukee? And Jamal, we'll start with you.
Yeah, thank you. So essentially what we're seeing is really the exacerbation of pain through the pandemic. We really realized the impact of not only physical trauma that COVID-19 has caused, but the psychological or the mental trauma as well, right? And so when you couple that with the fact that there were already increasing disparities within the city of Milwaukee, right? Whether that's in housing, the lack of quality housing for people of color, the lack of quality health care for people of color, education inequities, unemployment and underemployment, which are major issues within the city of Milwaukee. And then you see a pandemic come along and exacerbate those disparities. What you then produce from that is a lot of despair, desolation, pain, anger, frustration, which increases the engagement of risky behaviors leading to violence, right? So it's really understanding the fact that there is a societal issue, the societal ills, a societal dilemma that we have that is leading to a lot of the engagement and the violence that we see. So we have to look at root cause instead of saying from a symptom focus and looking at the people who are, we have to look at the people who are committing these heinous crimes or these unfortunate crimes. But the other part of that is, why are they doing that? What's happening? What are some of the experiences that they've been exposed to that is leading them to make these decisions? And what are some of the ills that have been really brought to the forefront on a macro level by COVID-19? How do we address those as well?
And Kwaku Tiangelo, you work specifically with youth. What does this look like with you on the ground?
No, thank you for asking. And Jamal really laid a strong foundation to a lot of what we're seeing. But when we talk about from the youth perspective, we have to be very conscious of the variety of opportunities for young people that has been directly severed due to the pandemic. When we think about youth development and all the various opportunities that are available to young people, and the access to information for those young people about those youth serving agencies has been directly impacted. If you think about it, you think about ourselves when we were in youth development, we got a lot of access to these opportunities through our schools. You would have organizations come into our schools table and share a variety of resources about what they have for us to get interested in a variety of careers that really can impact our passion and what our future is going to look like. But the reality is, due to the pandemic, due to schools transitioning to virtual, due to out of school programming directly being impacted and switching to virtual as well, you have young people who are doing virtual programming for school and virtual programming for after school programming. It didn't mesh well. And we recognized throughout the pandemic that a youth development piece was oftentimes void from the conversation. So again, thank you for this opportunity to discuss how youth development directly impacts a lot of our young people and the lack of accessibility due to the pandemic for safety reasons, why a lot of these resources for them were taken away.
Jamal, why exactly is this so much worse during the pandemic, with 2021 set to reach historic levels of homicide? How exactly do we get from a pandemic to homicide? What are all of the linkages in between?
Well, great question. And let's just provide a little context. There was an epidemic of gun violence even before the pandemic hit, right? Gun violence has always been a discussion. Violence as a whole has always been a discussion. And strategies about prevention has always been a discussion as well, not to the level that we would like to see as working in prevention, but it has been there. So then when you bring about a pandemic that actually, to Tiangelo's point, essentially changes the way of life, right? There were a lot of things that were switched, a lot of things that were ended, a lot of things that people had direct access to prior to the pandemic were taken away, in addition to the fact that people, lost jobs, lost income, desperation increased, right? And then even looking at Milwaukee, already the average, Black median income in the city of Milwaukee was $36,000 even prior to the pandemic. So when you look at what that could be now based on the pandemic, right, and how many people lost income because of it, that is what then increases the likelihood for the anger and the frustration that comes along with the engagement in violence. So then you also have to take into account the fact that trauma is a really big issue that is not discussed on a grand level, right? The levels of trauma that exist. A lot of people who engage in gun violence have been victims directly or indirectly of gun violence, right? Whether that's you've seen it happen or it's happened to you, right? So, understanding the generational aspect of trauma that a lot of individuals experience, plus the impact of community trauma, and talking about the lack that is existing within these communities that are highly impacted by that gun violence, right? So, it's just seeing that this is a complex web that's been woven. However, we must acknowledge that the complexity is there, right? And it's going to take a high level of engagement from like a multidisciplinary engagement in order for this to really be addressed, right? This can't just come from one entity. It has to be multidisciplinary approach.
And Kwaku Tiangelo, why are more and more of these tragedies happening to young people, particularly those under the age of 18?
Such a difficult question to answer, because as we recognize, young people are not a monolithic people. There's not just one reason why any one person makes the decision they make. There are a variety of reasons that when we talk about our young people and what's happening to them, what's not happening for them. And Jamal just gave so much context to a lot of the issues that are happening right now. When we talk about our young people specifically, it's truly like, in my vision of this, there's a lack of opportunity, a lack of access due to the pandemic. When we think about the safety of our young people, we recognize that them engaging in large groups gives them the opportunity to be exposed to COVID. So we recognize that small groups are ideal. But then when you think a step further back, when you think about our youth serving agencies that are oftentimes required to track numbers, and they're only allowed to have, at certain points of the pandemic, less than 10 people in a room, as Jamal talked about earlier, jobs. So we can no longer sustain multiple staff for an organization due to those stipulations for our safety. And that directly impacted our young people, their access to resources and safety, because not only do we have to think about our young people and those that serve them, but you think about those that they have to go home to, children that they have to keep safe, elderly that they have to keep safe. So everyone is thinking about not only their safety, but individuals that they have to go home to. So when you factor in all these various things, when you take steps back, it's very clear that we're talking about an access issue. We're talking about a resource issue for our young people. And we recognize that idle time is where, there's more opportunity for reckless decisions to be made. And due to the pandemic, there's been a lot of idle time for our young people, and they have been making more risky decisions during that time. And if we think about it, a lot of these young people probably would have been in youth serving agencies, probably would have been in after school programming that would have better directed them, better supported them, better resourced them. And the reality is, due to the severity of our pandemic that we're still in now, a a lot of these issues, it's going to be really difficult for us to transition out of unless we really start to think out of the box. We really have to think about the large spaces that we have, that we can safely bring in groups of individuals, particularly young people, to engage with each other in a safe way. And if you think about it, that level of investment has not occurred for our young people. And when we talk about, oh, our young people are doing this, our young people are doing that, we also have to factor in what are we not doing for our young people? And the reality is there's a lot that we're not doing.
And Kwaku Tiangelo, what are the conversations that you have with young people? What are they telling you? What are you hearing instead of, what people are just kind of assuming, like you said, our young people aren't doing this or they are doing that?
Yeah, another great question. I remember speaking to a young person, that was probably about 6 or 7 months back. I had a youth serving agency reach out to me that was directly trying to serve those young people who are making some of those reckless decisions. And she brought one of those young people on the screen and we were having a conversation. And I asked her, I just asked her as bold as you just asked me, what do you need? Like, what do you need for you and your peers to make less riskier decisions? And she said, we need all the stuff that we had before back. That's what she said. She said, I want to go to the movies. I want to be able to go bowling. Like these things that we took for granted. And the pandemic really severed, for safety reasons, why we couldn't do some of these things in larger capacities. And we know young people love to socialize. Young people love the opportunity to see their peers and engage with their peers. And due to the pandemic, a lot of those things that they were able to do for free, where they didn't have to think about, that unnecessary oversight. There were already strategic things in place to kind of oversee them. Like when you go to the movies, there's staff there already. There's security there already. There are things that we don't even think about because we take it for granted, that young people can freely go to and feel safe. And as Jamal stated earlier, a lot of things that are happening in our city right now have impacted a lot of our community in ways where they don't feel safe. So when we think about young people, we have to think about ways that they can go into spaces safely, feel secure, feel safe. And when we can create and identify those spaces, we'll be able for them to, in larger spaces, to come back. And there are some organizations who are doing that well. There are some organizations who are slowly trying to figure out what those hybrid approaches look like. And a lot of those conversations were happening through a collective impact coalition called Beyond the Bell. And it's our goal to really uplift the work of youth development. And when we uplift the work of youth development, we directly are serving our young people. And when we continue to invest in youth development, looking at what does it mean for organizations, staff, young people to feel safe and secure in a space, when we really start to have those deeper discussions, we'll slowly start to see ourselves coming out of some of these issues. Our young people will feel better supported. And that's what we really need. That's what we're really talking about. How can we better support our young people in ways that they can transition slowly but surely, as we very much so recognize we're still in this pandemic, but as we create spaces that are safer for them to be successful, a lot of these issues will slowly but surely start to fade away.
And Jamal, speaking of the broader impact on the community, not only are we seeing just the direct impacts of this violence on the community, but we also have the impacts of COVID deaths that are particularly impacting Black and minority communities in Milwaukee. And then on top of that, we went through a police reform movement last year. And when some people think of public safety and ways to combat violence, they think of police, but other people think of police as not necessarily helping the problem. How do all of these things impact ways in which that we can actually see ways forward out of this pandemic and violent epidemic?
I think great question. I think it provides an opportunity to truly have a dialogue about what public safety actually means and reimagining public safety. We know there have been conversations about, divest, reinvest, defund, and, a lot of that has been centered through a lot of the protests that have been global, not even just nationwide, but they've been global. But the conversation has to be, how do we begin to look at in a more innovative ways to invest in public safety, right? It's not just the conversation about we have to depend on one entity to solve the issues in all of our in all of our cities, especially our major urban cities. For example, there's a little over 1,700 rank and file officers in the city of Milwaukee, and the population is nearly 600,000. You are asking a lot for the police to be the only entity that's looked at for public safety. That's a lot for them, and that's a huge burden on the city itself. Versus being there a conversation about how do we also include efforts that are happening on ground, grassroots organizations, grass tops organizations, community-based organizations, areas like the Office of Violence Prevention and others that are doing work and looking at violence from a public health lens to figure out the best ways to elevate opportunities around social determinants of health, which are other preventative measures. We look at violence as a disease, right? And if it's a disease, that means it's preventable. So if it's preventable, then it needs to be preventative strategies put in place in order for it to end. So when we have these types of dialogues, right, it's imperative that people really understand exactly what prevention is, what's violence prevention, the complexities of violence, because there's always conversations about interpersonal violence, community violence, but rarely do we talk about systemic violence. Rarely do we talk about the ways in which laws and which policies and practices have been intentionally harming marginalized, disenfranchised communities, right? And we talk about the ways in which they've been divested from, and that also leads into the impact of the erosion of those neighborhoods, which leads to, again, the engagement of violence through risky behaviors because of the desolation, the trauma, and distress. So it's looking at all of those various levels and being able to, and layers, and having conversations. And we got to be truthful about this, and is it going to be uncomfortable? Absolutely, right? This is not an easy discussion. This is not something that needs to be where everyone's feelings are going to be considered, because there are going to be some times where there's some accountability that's going to be a part of that, right? So, even with the conversation about, police reform, conversation about discussing the levels of employment, or, what opportunities as access to opportunities, as Kwaku Tiangelo has referenced, we have to be honest in recognizing that there have been intentional strategies to keep those opportunities from particular communities, right? For example, when we talk about how there have been occupations or vocations in which we've seen applications or resumes for Black potential prospective applicants being discarded at a higher rate just because of their name, right? That's a systemic issue, right? That has nothing to do with the community, but that's also violence, because that's an intended harm, which is the very definition of violence. And when we talk about violence, having a systems approach to issues that systems perpetuate is counterproductive. So there's got to be other innovative ways, in addition to what we're discussing within systemic reform, in order to really change the landscape of what violence looks like.
And Jamal, as you're speaking about this, is the very fact that this is a public health approach, is that novel and innovative in and of itself? And you speak of it as a disease. And when we think of health, violence is sometimes physical harm, but is it also mental harm? Is it these structural determinants of health, these social determinants of health? Are all of these new ways of looking at what you said is this very long-standing problem as a way to reframe and potentially see new solutions?
I won't say that they're new, but I will say that it's an opportunity to look at different solutions, to your point. There have been conversations, even from like the Center for Disease Control and Prevention. You have organizations like the Prevention Institute in Oakland, California. They've been having these types of discussions and been leading at the forefront of prevention efforts for some years now. The issue is, to your point earlier, every time somebody talks about public safety, it automatically goes towards law enforcement, right? So the conversations have been minimal and haven't been as public in terms of addressing violence from a public health lens. Now we're starting to see the increase in that. And we can say here in Milwaukee, there has been a strong effort around getting people to understand violence from a public health lens. And with our Blueprint for Peace, which is a community-driven strategic plan around violence prevention that was released here in Milwaukee in 2017, it was the voice of the community that said, we want to look at violence from a different lens, and public health is the lens to look at it from. So now people are beginning to understand more so of what that means from a public health lens. And then that's what brings about those innovative strategies that can begin to address violence in various forms.
And Kwaku Tiangelo, when we think of interruption or intervention, are we thinking about the immediate interruption and intervention? As you mentioned, some young people just want to go to the movies, want to go bowling. Or are we also thinking about these longer term generational trauma or generational violence that people have experienced over and over? Does one take priority over the other? Are these both a part of what your office works on with young people?
It's definitely a yes and. Some folks are experiencing one form of violence more than another. And sometimes that can take precedent in your situation. So it's such a difficult question to answer because, again, it's individual based. But when we think about the public health approach, we think about the community. What are ways that we can heal the community? So when we talk about restorative practices, healing practices, interventions that do not require public safety to come into a space, but that can be mediated by community members, by family members, creating spaces where we can teach each other about the various forms that we can support each other is very important. It's vital, especially in this time that we're talking about. And as Jamal referenced, the amount of public safety we have versus the community we have at large, we recognize that there needs to be an additional layer of support that we can provide for ourselves, that we can provide for our community. And not just our community can be various things. Our community can be our home. Our community can be our family. Our community can be our school. Our community can be where we work. So when we talk about community, that's there's layers to even community. And spaces, when we talk about like schools in particular, there are great organizations and programs like violence-free zones that have staff within spaces where you don't have to call public safety, which is really set up to do more emergency-based violence. When we're talking about things where young people are having some disputes with each other within schools, we need spaces within schools like violence-free zone to come into those spaces, mediate for those young people, create spaces of healing. Those pieces are vital. And we need that approach to be given to our entire city, our state, even in our nation, in a stronger and more impactful way. We have to think about, as Jamal said, out of the box approaches that are not new. These are restorative practices are not new. These are old practices that our indigenous people taught us, and that we are continuing to teach to our families and our young people and our community at large. And we need to expand that work so that everyone has the ability to safely mediate a conversation between friends and family. Again, we're not talking about situations that are involving guns, where there should be an additional layer of training, additional layer of support, like our Cream City Credible Messengers have gone through the county. There are unique levels of training that are needed for those higher risk situations. But when we're talking about mediation, we should be able to talk to each other, and we should have the tools and the skills to be able to do that. We shouldn't be going to a situation where I can't talk to that person, I'm gonna go get my gun. We need to be working towards healing practices that make it safer for us to figure out things internally versus taking such drastic action.
And in the absence of a lot of these physical spaces that you're speaking of, how much are we seeing the virtual spaces kind of take over, as social media is also seen as a part of our mental health and public health? Kwaku Tiangelo, how much are we seeing some of these things begin on social media, and therefore it's difficult also for these people who are trying to help young people to intervene on the front end?
We definitely recognize that cyberbullying is probably at its all-time high. And our office has recently received a grant to better educate our families, our schools, about how we can mediate some of these cyberbullying situations. So that's one piece. And then when we talk about that virtual piece, we had a great speaker yesterday that really said something that I hope to incorporate in everything that I do. It's not about always, and I'll speak specific to young people, but this can be used in a broader brush. If our young people are on social media, we should be comfortable with meeting them on social media. We shouldn't feel like we have to pull them out of a space that they're comfortable in already and have to create a safe space for them when they were already in there. So when we think about, again, our young people, they are their generation is the social media era in a way that even my generation hasn't even experienced. But we have to, again, meet young people where they're at. If that's a space where you're comfortable and you're safe, and which indirectly impacts a lot of us, because a lot of us are working from home now, who would have known that working from home was safer than going to the office? You know, the different things that we experience from home to the office that we can avoid directly by working remote is another layer of discussion that I feel like we need to be talking about at a higher level. And I know some spaces are having those conversations. This is probably the most hybrid-based work era that we're going into right now, where folks are working from the office and also working from home. But that gives that individuals a level of understanding for what that young person is going through. To make assumptions about what a young person is going through isn't fair. But if you are living some of the experiences that they're living, it makes it a little bit easier to empathize, a little bit easier to understand what they're going through. Because we as adults, we have the ability to push through some of these pandemic barriers that young people don't necessarily have the access to do. We can still go to bars and things of that nature in the evening time, when young people really they have a very small opportunity in the evening time for them to socialize with their peers, while us as adults have a plethora of opportunities. So when we think about, some of the decision making that's happening at night, what are some things that we can do to elevate that work? So like the Midnight League is successful. Some of these transitional spaces that are housed in some of our MPS schools have shown great fruit. But what does it look like to bring those things to scale as we are still in this pandemic? And I think those conversations are what conversations we need to continue having and making action behind. And I think it's still difficult for us to do some of those things because it is so outside of our norm. But we're in a pandemic. Everything has changed. And we have to be comfortable making the changes necessary so that the safety of our young people is a priority.
This last question is for both of you, and Jamal, we'll start with you. For people who don't live with this kind of stress and this kind of trauma, but are listening and want to understand, what are some things that you want to make sure aren't kind of some preconceived notions that are adding to this idea of violence in Milwaukee? What do you want people who don't live in Milwaukee and who don't have to understand what it means to try and feel safe when they're walking around outside? When you are doing your work and you are trying to help kind of bring the broader message of safety to people in Milwaukee?
Great question. The first thing is I would challenge people to step outside of some of the old ideologies of what they believe happens within urban neighborhoods. Contrary to popular opinion, black and brown people are not inherently violent, right? So violence is not based on race. Violence happens because of pain. Violence happens because of trauma. Violence happens because of whatever types of feelings or frustrations or anger that leads to the decision to engage. Has nothing to do with race. That's one. Two, let's do an actual geographical analysis of your neighborhoods versus the neighborhoods that are highly impacted by violence. And then let's have a more in-depth discussion, right? When you start to really look at some of the areas that have all of the high quality of the social determinants of health that elevate quality of life, and then you start to look at neighborhoods that don't have that, right? And start to question, well, why is it that this is not an issue in my neighborhood, but this is an issue in your neighborhood? Then you have to be willing to really look at what those issues are, right? Root cause issues. Here's a great analogy I use all the time. Let's say you have 30 kids that are at a party with a piñata, and the birthday boy or girl takes the stick, busts the piñata open, and 3 pieces of candy fall out. What's going to happen with those 30 kids? They're going to attack each other for those 3 pieces of candy, right? Because everybody is trying to get to the candy, right? That's the same thing we have to look at in terms of resources. When it comes to a lack of resources in neighborhoods that have also been systemically divested from, and there is limited resources, and there's some form of it in those neighborhoods, immediately people are going to figure out the more desperate ways to get to those resources to sustain, right? Not just to, this is for survival. So when we are really looking at what violence is, we have to be able to say, what are some of the things that are causing, what are actually those underlying issues that are not discussed enough that needs to be discussed, right? So, Tiangelo even talked a little bit earlier about young people, and we always talk about the engagement of young people in gun violence. And what most people don't know is the average age of homicide victims is 30. That's not young people, right? So that means that there is a level of gun violence that is existing on all age levels. This is not a youth gun violence issue that we're having. This is a gun violence issue we're having. But then also we have to couple that and start looking at some systemic accountability. Why? Because of the easy access to guns, right? That's another issue that we have. In 2020, 40 million guns were sold nationwide. That was over 10 million guns more than in 2019. And then here we are in 2021, still that same easy access. And we are still dealing with the pandemic that is physically and mentally impacting people on great levels. So it's an all-encompassing effort in order to really address prevention. It cannot just be us looking and saying, these people are criminal, we need to address them from a punishment lens. But what are we doing in order to treat the impact of violence? We have to look at violence as preventable and look at it as treatable because it is a disease. This is a disease, right? We've been viewing the ways in which we address public safety from a very narrow lens, right? We've incarcerated people for substance abuse. We've incarcerated people for homelessness. We incarcerated people for mental health, and they need help. They didn't need incarceration, right? So there has to be investment in those areas that service people who are dealing with those social ills in order for them to get and then provide access and opportunity to resources that allows for them to live their best lives, to thrive, not just survive, to thrive. That's what's happening in neighborhoods that aren't being impacted by violence. And if this is a country where people always talks about the land of the land of the free, home of the brave, bring me your tired, your poor, your huddled masses. It's about life, liberty, pursuit of happiness, right? Laissez-faire. If this is all about justice, equality, freedom, equity, then people from neighborhoods that are not impacted by violence should be still advocating for those who are and say they deserve the same things that I have. They deserve access to the same resources I have. They deserve an opportunity just like I received, right? And that should be a grand advocacy piece to ensure that every person in this country has the access to the resources necessary for themselves to thrive and for their families. And when we see that happen, that's what violence prevention looks like.
Kwaku Tiangelo, same question to you. What do you want people to understand about this issue as someone who works very deeply in it?
I want everyone to recognize that we are all violence prevention. We all have a role in preventing violence. And if you take the opportunity to look at our blueprint for peace, we have 6 goals. Stop the shooting, stop the violence. Promote healing and restorative justice. Support children, youth, and families. Promote economic opportunity. foster safe neighborhoods, and strengthen capacity and coordination of violence prevention efforts. All of us have an opportunity to fall into one of these goals and can do multiple of these strategies. And even if you just do violence prevention for your family, for your direct community, for the children that you see, you're having an impact. You're having a real impact. And as you see yourself as violence prevention and you exude that through your life, you will see a greater quality of happiness, a greater quality of life. And these are just at the small levels, right? Smaller levels, because we all have the opportunity to bring happiness and joy to another person. And if we continue to live in that space, to realize that we have the ability to make a difference, to make a change, we will continue to see the shifts that we want to see. Because that's how Jamal and I are. We recognize and we see the great things that are happening in our city. We see how violence prevention is working. And it's not promoted in the same capacity as some of our violent acts that we see throughout the city are, but it keeps Jamal and I optimistic because we know what's working. We see it, we live it, and we recognize that it needs to be brought to scale. And when we continue to have these discussions, so again, thank you for creating this space for us. So we continue to have these conversations, we will continue to uplift we'll continue to uplift the need for violence prevention and the impact of violence prevention.
All right, we leave it there. Jamal Smith and Kwaku Tiangelo of the Office of Violence Prevention, thank you both very, very much for joining us today.
Thank you.
Thank you. Thank you for having us.
For more from Here and Now and PBS Wisconsin, you can visit pbswisconsin.org/news. And thank you so much for joining us on Noon Wednesday.